I had an inkling that I wanted to be a doctor at a pretty young age. I think I was about 10, and I insisted my younger siblings let me listen to their heart, look in their ears with my toy stethoscope and otoscope. I think one of the things I enjoy most about women's medicine is getting to hear the amazing stories that women have to tell. I learn a lot from my patients. I may learn really practical things like what's the newest in natural hair dye? Also really profound things like the difficulties of taking care of a special needs child and an aging parent. I feel really privileged to be trusted with these stories. I am a gynecologist, but I see teenagers who are confused as to what's happening to their bodies and, I need some help. And also to women who are in their much later years, well past menopause, suffering with things that happen later in life. One challenging aspect of my job is guiding patients when I don't yet have a clear-cut answer or a definitive diagnosis. Often there's still a next best step to take, but being able to make patients feel comfortable and to give them a context for that uncertainty can be challenging. I think it's something that I've gotten better with over the years of my practice. One important thing is to establish what the values of the patient is. And I think that its numbers can be overwhelming if they're just rattled off. So putting that in a context, such as, well, if I were going to Vegas, this would be really good odds. Or even putting into context of, well, driving is risky in this way. And to really be able to take the fear out of certain words like precancer and cancer and say, we want to rule this out, but the chances are highly unlikely. And if I were going to Vegas, I would bet for you that you would be just fine. One of my most memorable patient encounters was with a woman in whom I diagnosed a gynecologic cancer at her very first visit with me. She had been seeing other physicians, felt like her symptoms had not really been addressed seriously. So even though it was a scary diagnosis, she felt cared for and heard by me. So afterwards, even as she was undergoing her very difficult treatments, she made sure that her daughters came to see me for their routine care, even if they, at the time, lived hours away. And though she herself did not end up doing well, I see her daughters still, and that was many years ago. 3 words that describe me would depend on the perspective of the describer. If you ask my family, they might say, I am bossy. If you ask my friends, I think they would say I am generous. And as for me, I would describe myself as insightful, at least on my good days. In my spare time, I have several favorite things I like to do. I love skiing with my family. I have active boys who are quite good skiers, so I work hard to keep up with them. I love reading and discussing books in my book clubs. I belong to a couple. And I really enjoy leisurely jogs while listening to my favorite podcasts. I keep current in women's medicine by reading journal articles, attending seminars, and talking to physicians in my own and other specialties. As a gynecologist who operates frequently, I also use simulations, I trial devices, and I discuss surgical advances and ideas with my peers. Orange Coast Women's Medical Group is different. It really is the leader in women's healthcare in Orange County. The individual physicians are at the forefront of best clinical practice, and the group as a whole, in both its organization and its partnerships, has a growth mindset, which I really value. I'm excited and happy to be a part of this group.